Madam Deputy Speaker. In this Parliament we have spoken at length about the importance of valuing dignity at the end of life, and that principle must be applied to hospice and palliative care, which has faced uncertain funding and been too hard to access for too long. Now, like most of us, I have reason to be grateful for the work of palliative care professionals, and even though more than 15 years have now passed, I still remember with that great sense of gratitude and relief the compassionate care that my grandmother, Janet Russell, received at the end of her life at the St Mary's Hospice, which is now the Birmingham Hospice in Selly Oak. And in advance of this debate, I've been contacted by palliative care professionals in my constituency who have stressed the consequences of those long-term pressures that we have heard so much about tonight. The shortages of palliative care workers and the strain that this puts on those who remain. As one said, I'm deeply passionate about what I do, and I've seen many lives improved by palliative care, but I'm exhausted and often think about giving up. The strains on the system have led to, and I quote again from one of my constituents, a higher threshold for admitting patients and a lower threshold for discharging patients. We are being asked to stretch further with less for longer. You can't give quality medical care when your hands are empty. And they have stressed too that there can be public misunderstandings about the nature of palliative care, which reduces suffering and in fact on average extends life. But those misconceptions have, I have to say, in some cases been exacerbated by some of the media coverage of the assisted dying debate, which can make people less likely to seek that care. Now, a number of honourable members have spoken about the importance of children's hospice funding, and that children's hospice grant was effectively ended last year, although it is important to note that transitional arrangements were put in place. So the new funding announced before Christmas has been welcomed by the sector, and it's important to stress tonight how welcome that funding is. I heard that recently at the Acorns Children's Hospice, which in the last year has cared for 14 children from Northfield, and we've heard too about the plans that they have to put that funding to good use. When I visited recently alongside my constituency neighbour, the Honourable Member for Selly Oak, it is an exceptional facility. But the sector still does need long-term funding certainty set out on a multi-year basis if they are to deliver efficiencies and certainty for staff. And I would like to ask ministers, and I welcome the constructive approach that the Minister has taken since July on this issue, to give us an update today or soon on whether they will be in a position to either restore the Children's Hospice Grant on a long-term basis or provide similar certainty through another means. And whatever happens in this Parliament in respect of assisted dying, will they work with palliative care professionals to set out, as part of the NHS 10-year plan, a clear timeline for improving palliative care provision, which in too many areas is strained? I'd like to just finish by thanking the Backbench Business Debate Committee for making time for this important discussion, and to thank the Honourable Member for Wimbledon for the bringing of this debate and for the constructive tone in which it has been made.